Moving on into the shoulder, some of these, when we get into the bone, you will see some redundancy in terms of types of tumors you would find in bones, because obviously we are dealing with bones in each of these sections, so I won't really get into that a lot. Some other traumas you can see in the shoulder area are AC joint separation. And with AC dislocations, it's very important that we radiograph these correctly, because if our angles are wrong, then they can't see the separation as well. You see this is a Bankert lesion. That's a fracture of the anterior inferior glenoid rim. The glenoid fossa would be fractured in that case. Bursitis, which is common in the knee and elbow as well. Hill-Sachs defect is a compression fracture of the humeral head, just a special name for that fracture. Frozen shoulder is probably better seen on an MRI than X-ray. The patient would probably start out with a plain X-ray first to rule anything else out. If they say the X-ray is negative, then they might have an MRI afterwards. Again, this is kind of where we get into the redundancy that we've kind of already talked about. So on the next couple slides, this one is arthritis. And then again, osteoporosis, which we've already talked about. And then rheumatoid arthritis, we talked about in the upper limb portion. Rotator cuff tear are also very common in the shoulder. Those you may image with an arthrogram, but more commonly, again, they are better seen with an MRI. Dislocation in the shoulder, you will see those come through in the ER sometimes, and you'll have to do x-rays of those. Tendinitis, again, is more seen on an MRI than a plain x-ray. These plain x-rays can be done first and then an MRI if recommended.